Juanita Stevenson. Welcome to 0 to 5 in 30 minutes. We begin with a difficult topic, child abuse. What happens to those young, often voiceless victims after the abuse is reported? Well, there is a unique local program ready to step in and help. Today, we hear how a team of professionals is addressing the mental and developmental needs of these children. When a child is removed from his or her home because of abuse or neglect, they enter the court system, and oftentimes they are eventually placed in foster care. Kathy Huerta, the director of the Department of Social Services in Fresno County, says children might be abused for a number of reasons. It can be related to anything from a lack of parenting skills to parents' drug use and, yes, money issues.
Sometimes we have seen an increase, and it's very much, I think, tied to the economy on physical abuse cases. I think families that are really struggling at home, struggling to make ends meet, going through a lot of really stressful situations, such as we've experienced for the last couple of years, it's hard to control. It's hard to control emotions, anger. Unfortunately, sometimes their kids get the brunt of that.
Tricia Gonzalez, a social work supervisor with the Department of Social Services, says there are many young victims in Fresno County.
At any given time, we generally have approximately 600 0 to 5 age children, and coming into the system in any given month, we have anywhere between 25 to 55 kids.
These children have the support of the 0 to 5 Child Focus Team, a program of the Department of Social Services. The team focuses on the areas of safety, permanency, and well-being.
They're there to talk about what are the needs of this particular child. Does this child need any medical attention right away? Does this child need any developmental screening? If this child is showing some developmental delays, they work to make sure that they get hooked up.
It consists of a social worker, a public health nurse, mental health clinician, preschool education liaison, permanency specialist, and a home visitor who is an experienced foster parent.
The foster parent, who's got years of experience in working with small children, she makes a home contact to where the child's being placed. She introduces herself to the provider, whether it be a relative or another foster parent. She's able to talk to the provider about that particular child and what those needs are, and form a relationship of which this care provider, hopefully, at times she may need to talk, she may have questions, and she can't get to her work or whatever, she can call this foster parent.
Basically going to look at where Brooklyn is in her developmental skills in several different areas. Motor skills, her communication skills, social skills. Can she catch a ball with both hands?
The team works with the child and caregiver, then meets to go over the child's case, making sure he or she gets the services he or she needs to be healthy and thrive.
Each member of the team has their own area of expertise. They're going to be focusing specifically on their area and looking for concerns. They've also developed the resources and the relationships with service providers in those areas. So by meeting together, we're able to kind of think comprehensively about the whole child, and that's going to be a better outcome than just an individual reviewing a case. It's difficult for any one of us to cover all areas and consider all areas at each time.
The team is designed to help children in the 0 to 5 age group because this age group is the most vulnerable.
With a child 0 to 5, it is really easy to hide that child. It's harder for us as a system to find out that any kind of abuse is going on, because if you don't take your child to a doctor, if your child's not involved in any type of preschool, so your child's not out there to where other people can see, then that child becomes very vulnerable. It's usually a nonverbal population. Kids can't talk. So when we go in and talk, generally even 4 and 5-year-olds who could be verbal, you got to be real careful. Do they understand the difference between truth and lie? Where's their imagination? It's just a more difficult population to protect, which means we have to be more protective about them.
If you suspect child abuse, you can call the Fresno County Child Protective Services hotline at 559-255-8320 at any time. And if you are in Tulare County, you can call 800-331-1585. Of course, if you have an emergency, call 911. And to contact the Child Focus Team, call 559-445-3306.
This program funded in part by First 5 Fresno County. At First 5, we focus on the first 5 years of life. We fund programs and services that better the lives of children in Fresno County.
Additional funding from First 5 Tulare County. Changing lives and building futures. Because it's all about the kids.